The University of Michigan is really a wonderful place for both clinical practice and research. Division of Gastroenterology and Hepatology was founded in 1947. It's one of the oldest divisions in the country. We have a rich history of academic excellence and excellent patient care. Currently, we have 74 faculty members, 25 GI fellows, and over 200 staff members. In 2014, we see approximately 35,000 patients. We perform 25,000 endoscopies. Our clinical practice is not limited to only the university hospitals. We have 14 locations around the campus. In addition, we also perform procedure in 5 procedure units. Division of Gastroenterology and Hepatology has multiple missions, but the 3 most important missions is teaching, clinical care, and research. Our research enterprise is anchored by the Michigan Digestive Disease Center. The center has 74 investigators with a research base over $30 million a year.
The research in my laboratory is focused on trying to understand the basic biology of the earliest stages of pancreatic cancer. And so by understanding this critical window of time, we hope to then develop new ways to diagnose this cancer earlier and to treat our patients with this deadly disease in a better manner. So this has led to the initiation and continuation of a novel clinical trial. And in this clinical trial, we found that indeed a number of patients who are at high risk for developing pancreatic cancer actually have significant numbers of pancreas cells in the blood.
My research here in the lab is to develop new ways of performing imaging for early detection of cancer in the digestive tract, in particular in the esophagus, stomach, and colon. We develop targeted imaging agents, in particular peptides, that look at specific expression of cell surface targets that can help us find lesions that are flat and otherwise difficult to see on conventional endoscopy that could lead to preventable cancers.
In the last 7 years, we have conducted more than 300 clinical trials involving 25,000 patients.
We have more than 50 active clinical trials at the University of Michigan in IBD. And most recently, our successes have included gut-specific anti-adhesion therapies, which block the immune system of the gut alone, reducing the safety issues with immunosuppressing the entire body.
The Michigan Bowel Control Program was developed in 2005.
The Michigan Bowel Control Program was conceived from the realization that a fully integrated multi-specialty group could truly be greater than the sum of its parts. In addition to providing excellent medical and surgical care, and also offer a suite of ancillary services. So for example, our GI physiology laboratory performs comprehensive manometry services, breath testing, colonic transit studies, and a variety of other physiologic tests that help us to understand the underlying abnormalities which explain why a person is having problems with constipation or fecal incontinence. We're also very proud of the presence that we've built in GI nutrition. We've actually grown now to have roughly 4 full-time equivalent GI dietitians. And then finally, we're also very proud of the footprint we've created in behavioral medicine, acknowledging that chronic conditions in general oftentimes are associated with significant psychosocial comorbidity.
Endoscopy is an important tool for our subspecialty. It allows us to directly visualize into the lumens.
We perform about 16,000 endoscopies here a year. We have 2 off-site endoscopy units, or ambulatory endoscopy units, one in Ann Arbor and one that's about 20 miles east of here. And they each perform 6,000 to 8,000 endoscopies per year.
Teaching and education is one of our major missions of the divisions. Over the years, we have trained more than 300 gastroenterologists practicing in 34 states, and many of them are now leaders in their own rights.
The division has really exceeded all of my expectations in terms of helping me be a better fellow and preparing me to be junior faculty. My mentors are continually pointing out opportunities for me that I wouldn't have otherwise seen.
I'm very optimistic about the future of gastroenterology and hepatology. I firmly believe in the next 10 or 15 years, we are going to see major changes in many of our thinking of current GI disorders.